My name is Dr. Sanjeev Baga, and as a part of the patient education series, I'll be talking about diabetes. Please remember that diabetes is a disease where the sugar levels are abnormally high and the body cannot produce enough insulin. This leads to excess urination and thirst, which causes loss of weight, even when the patient is not trying to lose weight. Now, in diabetes, there is damage to the nerves, which causes problem with sensation. There is damage to the blood vessels, and there is increased risk of heart attack, stroke, chronic kidney disease, and vision loss. Diabetes is diagnosed by measuring blood sugar levels. Patients need to eat a diet which is low in refined carbohydrates, saturated fat, and processed food. Once the body absorbs simple sugar, it usually converts all of them into glucose. Now, glucose is the sugar that is transported through the bloodstream and taken up by the cells. Body can also produce glucose from fats and proteins. Now, the sugars can be simple or complex. Table sugar or sucrose is made of two simple sugars called glucose and fructose, whereas milk sugar or lactose is made of glucose and galactose. Carbohydrates in starches like bread, pasta, rice are long chains of different simple sugar molecules. These complex sugars must be broken into simple sugars, and this is done by the enzymes in the digestive system before the body can absorb them. Now, insulin is a hormone that is released from the pancreas, which controls the amount of glucose in the bloodstream, and the glucose in the bloodstream stimulates the pancreas to produce insulin. Insulin is the hormone that helps glucose to move from the blood into the cells. Once the glucose is inside the cells, the glucose is converted into energy, which is used immediately, or it is stored as fat or glycogen in the liver until it is needed. Now, remember that glucose levels in the blood vary throughout the day. When you eat something, the glucose levels go up, and after 2 hours, they come back to the normal. Once the levels of glucose in the blood return to the normal, insulin production decreases. If the body does not produce enough insulin to move the glucose into the cells, or if the cells stop responding normally to the insulin, a process of what is called as insulin resistance, that is when a person has diabetes. Now, it results in high levels of glucose in the bloodstream, and it results in inadequate amount of glucose in the cells. A condition called prediabetes is when the blood sugar level or glucose level is between 100 and 125 milligram per deciliter in a fasting state, when the patient has not eaten anything, and 2 hours after glucose loading, or what is called the glucose tolerance test, it is between 140 and 199. Now, these patients have a high risk of diabetes and heart disease in the future, and if they manage to lose weight, the chances of their developing diabetes are much more reduced. Now, other than the pre-diabetes, there are two types of diabetes, 1 and 2. Now, type 1 diabetes is a situation where the body's own immune system produces antibodies against insulin producing cells of the pancreas. Now, we don't know the cause for this. There are many theories, but bottom line is that the pancreas is damaged, and the insulin producing cells of the pancreas are damaged, and then it does not produce enough insulin or no insulin. Now, 5 to 5 to 10% of these patients who are diabetic are actually type 1, and most of them are um, younger than 30 years of age, and rarely this disease does develop later in life. On the other hand, type 2 diabetes is where the patient initially produces enough insulin and sometimes even produces high levels of insulin, but later on the insulin levels go down, and the amount of insulin that the body needed, the body is not able to produce it. So this is rarer in children and adolescents, but it is becoming more common, and it is more common in somebody who's above 30, and it is more common as patients age. It runs in the families, and obesity is a chief risk factor. And most of the patients who have type 2 diabetes also are obese or overweight. It is important to remember what are the symptoms of diabetes? Now, somebody who has increased thirst, increased urination, increased hunger, as the blood level goes above 180, the glucose spills into the blood and spills into the urine, and it draws more glucose. As the glucose becomes more in the bloodstream, it draws more water, and so the kidneys produce more excrete more water to dilute the amount of glucose, and you have a patient who's producing excessive urination, and as a result there is abnormal thirst and loss of weight, and the patient is feeling more hungry. uh, Now the other symptoms are the patient becomes drowsy, has nausea, has blurred vision. Now the diabetics, the blood vessels are damaged and they become narrow and restrict blood flow. There is the organs that are affected are a brain, which can lead to stroke. It can cause loss of vision, or what is called as diabetic retinopathy. And then you have a situation where the heart is affected, and you will have heart attacks or chronic kidney disease or decreased sensation in the nerves. Now, how do we diagnose diabetes? We check the blood glucose levels after the patient is fasting and after the patient has eaten. Now, the fasting glucose level should not be more than 125 milligrams per deciliter, and if the patient has a postprandial or after a meal glucose level, it should not be more than 199. Now, another measurement or another way to check for diabetes is to check what is called hemoglobin A1C, or glycosylated hemoglobin. Now, when the blood is exposed to high glucose levels, over a period of time, the glucose attaches to the hemoglobin and forms what is called as a glycosylated hemoglobin, which is reported as a percentage, and it reflects long-term trends in blood glucose levels rather than rapid changes. And if somebody has a hemoglobin A1C level of 6.4% or more, this person definitely has diabetes. Whereas if it is less than 6.5, this is a pre-diabetic person. Now, who are the patients who are type 2 diabetic and have a risk? Typically, these are people who are above age 45. They have pre-diabetes. They are obese, overweight. They have a sedentary lifestyle. They have a high blood pressure or high cholesterol. They have high risk of family history of diabetes. They have heart disease, and somebody who's had diabetes during pregnancy, or a child who's more than 9 pounds at weight. Now, what do we do for treatment? Well, first of all, diet, exercise, weight loss. We educate the patient. In type 1 diabetes, we give insulin. In type 2, we have medication. What is the aim? What is the goal of treatment? We want to keep the fasting glucose level between 80 and 130 before meals, and after 2 hours of meal, it should not be more than 180. And at all times, the hemoglobin A1C levels should be less than 7%. Now, the lower the level of H1 hemoglobin A1C is, the better the patient is, and less chances of complications. And as the levels go up, the chances of developing complications are much higher. In addition, we want to make sure the patient has a systolic blood pressure of 140 or less, and a diastolic pressure of 90 or less. And the bad cholesterol, which is the LDL cholesterol, is low and less than 100 milligram per deciliter. So these are the aims that we have for treatment of diabetes.